Hi, my name is Lisa Coleman. I'm a student at Eastern Kentucky University in the Master of Science Family Nurse Practitioner program. Let's Get Physical is a project aimed to improve physical activity in adolescents. According to Healthy People 2020, 16.1% of children and adolescents were considered obese in the years 2005 through 2008. Only 27.1% of high school students participate in at least 60 minutes of physical activity all 7 days of the week. Regular physical activity can help children and adolescents improve cardiorespiratory fitness, build strong muscles and bones, control weight, and reduce symptoms of anxiety and depression. It also reduces the risk of developing health conditions such as heart disease, some cancers, high blood pressure, and osteoporosis. The significance of this problem as a future advanced practice family nurse practitioner is that obesity in children and adolescents can lead to adult obesity, along with an increased risk of non-communicable diseases, which leads to an increased risk of heart disease, strokes, and potentially other health complications and problems. The World Health Organization states that the number of obese children and adolescents worldwide has risen tenfold in the past 4 decades. The purpose of this project is to evaluate a school-based intervention for adolescents on increasing their physical activity, potentially leading to a healthier lifestyle. Prospective participants will be freshman students at 2 designated high schools in Fayette County, Kentucky, who are enrolled in the health and physical education classes. Advanced practice nurses are dedicated to caring for the overall health of patients, including preventative care and helping patients establish good, lifelong, healthy lifestyles. External evidence regarding this problem and occurrence was collected from the World Health Organization, the Centers for Disease Control and Prevention, and 4 studies that were conducted within the last 5 years. 3 of the studies were level 2 evidence, and 1 study was a level 3 evidence. All of the 4 studies had an intervention that included a specialized education program in the school setting. 3 of the 4 studies had a physical activity component combined with the education. All 4 of the studies showed results that had improved physical activity as measured by number of steps taken by participants. In addition, the results of the intervention group showed improved weight control or improved BMI when compared to the control group who gained weight over the same amount of time. The proposed intervention plan for this project will consist of a verbal script to describe the project to freshman students who are enrolled in the 2 chosen high schools in the health and physical education classes in Fayette County. Assent of participants and parental permission will be obtained, and it will be reinforced that this program is strictly voluntary. All participants will be given numbers, and they will also be given journals to document their physical activity in time or steps, and they will have corresponding numbers, so their identity will be kept blinded. A questionnaire will be given out to all participants asking how much physical activity they currently do, if there are any barriers to doing more physical activity. Also included in the questionnaire is, do they have access to a Fitbit, Garmin, some type of step tracker, or a watch, clock, some way to record their physical activity time if they don't have a way to record their steps. Weight and height will be documented, and a BMI will be calculated. And all students will be asked to document their steps or physically active minutes. The education will be once weekly for 9 weeks and administered by the school nurse and/or the project leader. The project will start at the beginning of the school year and continue through the first 9 weeks, which equals the school semester. Each week, an item will be discussed, whether it be what is overweight and obesity and how to avoid it, good eating habits, how to become more physically active, etc. The information given will go beyond the standard procedure for the current state mandated health classes. In addition, each class period will consist of group exercise physical activity for 20 to 30 minutes of the 60 minutes. The participants will also be asked to increase their physical activity daily. Documentation of the physical activity will be recorded on the log as number of steps taken or number of minutes being physically active. There will be an optional after-school fun physical activity program administered by the project leader and school nurse. The purpose of this is not only to get participants active, but to show them that physical activity can be fun, and it's more than just walking, jogging, team sports that they associate with physical activity. After the semester is over, 9 weeks, the data will be analyzed. A questionnaire will go out again as far as did they increase their physical activity, how they felt doing so. And then the data will be analyzed using ratio scales. Likert scale will be used for the questionnaires. And BMI will be calculated using the Centers for Disease Control program. Repeated Mankova, Cohen's d, Fisher's exact, chi-square will be utilized to evaluate and ensure validity. In conclusion, Healthy People 2020 state adolescents who are at a healthy weight have less likelihood of becoming obese adults and don't have an increased risk and factors for stroke, hypertension, and they have a longer life expectancy. This project that will be taught in schools will give the participants the knowledge they need regarding physical activity and healthy lifestyle choices, which in turn can give them the confidence and belief in themselves and knowledge needed to improve their physical activity and lifestyle choices. As an advanced practice nurse, helping implement a specialized education program in schools can improve physical activity and education of adolescents, thus improving their weight, BMI, and healthy lifestyle choices, leading to overall improved health and less risk factors for disease. Thank you for taking the time to view my presentation.